Hi guys, welcome to this session. Now in this session we're going to discuss 2022 CET anatomy questions. Regarding anatomy, I'm saying all the questions were repeat questions only. See, repeat in the sense the question will come from the same topic, but they won't give the exact question. They will modify the question. Now see this diagram. A similar diagram was given in the previous AIMS exam. Now in that exam they were asking you to identify the marked gland, that is our sebaceous gland. So now in this question, now we're going to discuss our identify the merocrine gland in the given diagram. Now in this diagram, yes, this is the image of the skin histology. Now why I am saying skin histology? Because you are seeing the hair follicle here, yes, and we are also seeing the stratified squamous epithelium, and this is the keratin. That is the keratin, and this is the stratified squamous epithelium. So this is the image of the skin histology, right? So now see the A. Now A, that is our sebaceous gland or holocrine gland. Now why I am saying the holocrine gland? Holocrine gland means the many layers of the cells are seen and the cells disintegrate and then they give the secretion. That is a holocrine gland. That is a previous AIMS question. But the question is about identify the merocrine gland in the given slide. So now we're going to discuss, yes, the different types of the gland based on the mode of secretion. So we have merocrine gland, apocrine gland and the holocrine gland. So merocrine gland means the cells secrete the products by means of exocytosis. Here they have the intact cell membrane. That is the merocrine gland. Examples are the sweat glands and the exocrine glands. The sweat glands and the exocrine glands are the example for merocrine glands. So next is the apocrine glands. Now what is apocrine glands? The secretions are collected in the apex and the apical part will be detached. Now where you see the apocrine gland, mnemonic MAP. MAP means M, mammary gland, AP, atypical sweat glands in the axilla and the pubis. So mnemonic is, MAP is a mnemonic. Mammary gland, atypical sweat glands in axilla and pubis where you see the apocrine glands. Now next to holocrine gland. Holocrine gland means the whole cell will disintegrate and release the content. So the whole cell disintegrating means we need to replace the disintegrated cells. So you will see the many layers of cells and the basal cells are mitotic and they replace the disintegrated cells. Okay, that is our holocrine gland. Now if you see the histology of the merocrine gland and the apocrine gland, now you see the narrow lumen for the merocrine gland or eccrine glands. Whereas the apocrine gland, the lumen will be large. Why they have large lumen? Because the apex is detached. So they have a wide lumen. Okay, right. So now see the question. So identify the merocrine gland in the given diagram. So what is A? A, you are seeing the many layers of cells and they disintegrate and release the content. So A is the holocrine gland, our sebaceous gland. Okay, sir. Now what is B? Yes, B is our, yes, we are seeing the small lumen there. That is the merocrine gland. Yes, and that is the sweat glands. Okay. Now what is D? What is D? D can identify? Yes, the nucleus is seen at the periphery and you are seeing the large flat droplets. So D is nothing but our adipose tissue, fat cells. And C is nothing but the hair follicle. So what is the answer for this question? So what is the merocrine gland? So merocrine gland is, B is our merocrine gland. B is the answer for this question. Okay, right. Now see the next question. Arrange the following cells in the basal to the luminal side order. Spermatogonia, spermatozoa, primary spermatocyte, spermatid and myofibroblast. Again this is a repeat question only. 2019 May AIMS exam we got this question. Arrange the cells in sequence. Now here they are asking you to arrange the cells from base to the lumen. So now this is the image, yes, and here we are seeing the spermatogonium. Yes, After the spermatogonium, you see the primary spermatocyte, and then secondary spermatocyte, and then spermatid, and then spermatozoa, and then finally spermatozoa. So spermatid undergoes spermiogenesis and forms spermatozoa. But now in the periphery, you have the myofibroblast, the myoid cell present here. The myofibroblast present in the periphery. Myofibroblast or the myeloid cell present in the periphery, they move the cells towards the lumen. So the outermost cell is our myofibroblast. Is that clear? So if you get this clue, then our answer, yes, we got the answer. So the first cell from the base is our myofibroblast. So 5 is the answer. And then spermatogonium. Okay. And then primary spermatocyte. And then secondary spermatocyte. And then spermatid. And then spermatozoa. So B is our answer. So first myofibroblast in the base. Now from there, our spermatogonium. And then spermatocyte. And then spermatid, and then spermatid, finally spermatozoa, and then spermatozoa. Okay, so answer for this question is, yes, B is the answer for this question. A similar question was given in 2019 May AIMS exam. Okay, again repeat question. Now third question. See the third question. The child lacks thymus and inferior parathyroid. Which of the following marked structure is affected? See, we got this question so many times. Very recently, they gave this question in 2021 INACET exam. The same question they gave you again in 2022 May INACET exam. Okay. So now the marking is on 1, 2, 3, 4. That is endodermal pouches, the marking. So now you have to know the derivatives of endodermal pouches. So we have 4 endodermal pouches. The first pouch will form our tubotympanic recess, which will form the middle ear and the eustachian tube. The second pouch will form the tonsil, palatine tonsil and the tonsillar fossa. Third pouch will form the thymus gland and inferior parathyroid. Fourth pouch will form superior parathyroid and ultimobranchial body. The ultimobranchial body forms parafollicular cells or C cells of thyroid. Recently, they made a change. In 2016-17, they made a change, and the parafollicular cells are coming from neural crust cells greater than ultimobranchial body. Okay, so now we're going to see one important applied, that is our D-George syndrome. So D-George syndrome is 22q11 deletion syndrome. That is deletion syndrome. Which chromosome is deleted? 22q11 deletion syndrome. Now what will happen because of this deletion? The third pouch failed to differentiate into thymus and inferior parathyroid. So what will happen to the baby? The baby will be brought to the hospital by the mother with recurrent episodes of infection because baby is not having the thymus. So immune status will be very poor. So mother will bring the child to the OPD with the complaints of recurrent episodes of infection, and the baby also have very low calcium levels. Okay, so now see the question. So the child lacks thymus and inferior parathyroid. Now which of the following marked structure is affected? We know the answer. Answer is 3 is the answer for this question. Okay, right. Now see the fourth question. Now fourth question, yes, again this is a repeat question only. 2016 November AIMS exam, we got the same question. Okay, now the question is, damage to the marked structure result in the paralysis of which of the following muscle? Option A, lateral rectus, B, superior oblique, C, razorius, and D, LPS muscle, levator palpebrae superioris muscle. Now in this diagram, yes, we are seeing the floor of the fourth ventricle. Now this is midbrain, okay, this is pons, and this is medulla. Now between pons and medulla, yes, we are seeing a diamond-shaped cavity, that is our fourth ventricle. Now the fourth ventricle, the floor is formed by the lower part of pons and the upper part of medulla. Now in the lower pons, we see one swelling here. Now this swelling is called facial colliculus. So facial colliculus, there is a swelling you see in the lower pons. Name itself you have a clue, facial colliculus. So facial colliculus is due to, colliculus means round swelling. So facial colliculus is due to the axons of facial nerve. The axons of facial nerve will wind around and makes one bulge, that is called facial colliculus. Now what is the structure present inside the facial colliculus? We have one nucleus. Which nucleus? Our abducent nerve nucleus. Sixth nerve nucleus is present. So facial colliculus is due to, what is the answer? The axons of facial nerve greater than abducent nerve nucleus. So damage to facial colliculus means, damage to facial colliculus means the axons of facial nerve are affected greater than our abducent nerve nucleus. Now see the question. Now we have a damage to facial colliculus. Facial colliculus is marked. So which means that the facial nerve axons are gone, which means that muscles supplied by facial nerve are paralyzed. Now lateral rectus supplied by which nerve? Very good. Sixth nerve. Superior oblique supplied by fourth nerve, trochlear. Risorius, muscle of face supplied by seventh nerve. LPS, levator palpebrae superioris, supplied by third nerve. So damage to facial colliculus means which muscle will be affected? Yes, risorius is affected. C is affected. If C is not given, then you have to go for A. Yes, very good. So now damage to facial colliculus means our, yes, risorius muscle will be affected greater than lateral rectus muscle. So seventh nerve greater than sixth nerve. So C is the best answer here, greater than A. Is that clear? The same question was given in 2016 AIMS exam. Clear? Right. Now this is a brand new question. Now mention the blood supply to the marked structure. See, marked structure, yes, we are seeing the medial view of the brain, and the marking is on the anterior part of the corpus callosum. Now the corpus callosum, it is supplied by, see, blood supply to the corpus callosum, it is rich and strengthened by anastomosis. So corpus callosum very rarely affected by the infarct. First basic point. Now what are the blood supply to the corpus callosum? Corpus callosum is supplied by pericallosal artery. Now the pericallosal artery is coming from anterior cerebral artery. Now the medial surface, majority of the medial surface is supplied by our anterior cerebral artery only. So anterior cerebral artery is giving the pericallosal artery, yes, and that is supplying the major part of our corpus callosum. Now, can you see this artery here? This is our basilar artery, and the basilar artery is giving this branch, that is our posterior cerebral artery. Now the posterior cerebral artery, posterior pericallosal artery is coming from posterior cerebral artery that supplies the splenium of the corpus callosum. Splenium of corpus callosum that is supplied by posterior pericallosal artery. Okay, and the anterior part of the corpus callosum, it is also supplied by our anterior communicating artery that is also giving the median callosal artery. Okay, anterior communicating artery also gives the median callosal artery. Now please remember our middle cerebral artery. Now this is a diagram. Now this is our anterior cerebral artery is giving the pericallosal artery supplying the, yes, the major part of corpus callosum. And this is our posterior cerebral artery. It is supplying the splenium of the corpus callosum, giving the posterior pericallosal arteries. And the anterior communicating artery is also giving the branch. Now the lateral part of corpus callosum, see here. Now this is our corpus callosum. Okay. Now this is the anterior cerebral artery, pericallosal arteries. And the anterior communicating artery also gives a branch to corpus callosum. Okay, sir. Now what about the lateral part? Now the lateral part of corpus callosum, it is also supplied by middle cerebral artery. So middle cerebral artery also gives a branch to the lateral part of corpus callosum. So the corpus callosum is supplied by, main blood supply is our anterior cerebral artery, pericallosal artery. Posterior pericallosal artery is coming from posterior cerebral artery. Now the anterior part of corpus callosum is also supplied by the branches from our anterior communicating artery, and that branches are called median callosal artery. and the lateral part of corpus callosum is supplied by our middle cerebral artery. Now see the question here. Now the marking is on the anterior part of corpus callosum. So the answer should be our anterior cerebral artery. So option A, B, C have anterior cerebral artery. Okay, sir. Now posterior cerebral artery, no. Posterior cerebral artery supplies the posterior part of corpus callosum. The marking is on the anterior part of the corpus callosum. So option B is not correct. Again, marking is on the, not on the lateral surface, the medial part of corpus callosum. Again, it is not the middle cerebral artery. So answer is anterior cerebral artery and anterior communicating artery. That is the one which is going to supply the marked part. Now this is a brand new question. So similar question will be given in 2022 November INACT exam or 2023 May exam. This question again they will ask you. Okay? Right. So that's all about this question. Now come to next question. Now which of the following foramen is present between the three bones? Okay. So now see the diagram. Now this is the superior view of the skull base and we're going to mark the bones. This is the lesser wing of sphenoid. This is the greater wing of sphenoid. This is body of sphenoid and this is the parietal bone. And this is the frontal bone and this is the temporal bone. Now in the temporal bone, this part is called petrous temporal bone and this is our occipital bone. Okay. See, in 2021 November INACT exam, we got this question. Now the question is, the patient is having skull base injury and that foramen is present at the junction of temporal bone and the occipital bone. So which foramen is present at the junction of temporal bone and the occipit bone? That is our jugular foramen. That is a question they gave you 2021 November INACT question. A similar question was given in your 2022 May INACT exam. Now this is the sphenoid bone and this is our occipit bone. Occipit bone, I am writing as O. This is the temporal bone T and this is the sphenoid bone. So this foramen, it is present at the junction of three bones, sphenoid, occipit bone and the temporal bone. That is our foramen lacerum. So that is the answer for this question. The foramen lacerum is present at the junction of three bones, sphenoid bone, temporal bone and the occipit bone. Okay, again I told you no, the questions will be from the same topic but they won't ask the exact question. They will modify the question and they will ask. 2021 November we got the question about jugular foramen. So they modified that question and they gave in 2022 May INACT. Okay, right. So foramen lacerum is the answer for that question. Right. Now in the petrous temporal bone one foramen is seen. What is that? Yes, that is our internal auditory meatus. Now in the occipit bone we see one foramen. What is that? That is our hypoglossal canal. Okay. In the lesser wing we see one foramen. That is our optic canal. In the greater wing we are seeing three foramens. Foramen rotundum, foramen ovale and foramen spinosum. These are the future questions. See, INACT definitely one question will be there from the skull base foramen. 2021, yes, in the May exam, we got the question about the cribriform plate of ethmoid, intracranial spread of COVID through which are the following foramen. Every year, they are asking one question from the cranial cavity, skull base foramen. Okay, INACT, yes, again 2022 November INACT, you will get one question for sure from the foramen. Now sum up. Now lesser wing, you see only one foramen, that is our optic canal. In the greater wing, we see three foramens, foramen rotundum, foramen ovale and foramen spinosum. At the junction of three bones, sphenoid, occipit and temporal bone, our foramen lacerum. Petrous temporal bone, we have one foramen, that is our internal auditory meatus. Junction of temporal bone and the occipit bone, jugular foramen. Hypoglossal canal, it is present in the occipit bone. Clear? Right. So that's all about this question. Now, which are the following structure passing through jugular foramen has a separate canal? Now, this is our jugular foramen. So jugular foramen, we are dividing the jugular foramen into three compartments. In the anterior compartment, inferior petrosal sinus. The posterior compartment, sigmoid sinus, which in turn continue as internal jugular vein. In the intermediate compartment, 9th nerve, 10th nerve and the 11th nerve. 9th nerve have the separate canal. The 10th nerve and the 11th nerve, they are passing through the common canal. That is the question. So 9th nerve is having the separate canal passing through jugular foramen, and that is the answer for this question. The 10th nerve and 11th nerve, they have a common canal. 12th nerve is not passing through jugular foramen, that is passing through hypoglossal canal. So answer for this question is option A, 9th nerve. Okay. Now, which of the following is not a branch of facial artery? Again, very old question. Option A, lateral nasal, B, mental, C, superior labial and D, inferior labial artery. Now, the facial artery, it is a branch of our external carotid artery. And external carotid, anterior branch. The anterior branch of external carotid, we have three branches. What are those? This is our superior thyroid artery, and this is our lingual artery and facial artery. So these three are branches from the anterior part of external carotid. Now internal carotid in the neck, how many branches it will give? No branch, 0 branch in the neck. Very good. Now the facial artery in the neck give 2 branch. What are those? In the diagram we are seeing that clearly. Number 1, our ascending palatine artery and the tonsillar artery. The tonsillar branch from the facial artery. Okay. So in the neck, the facial artery gives, yes, ascending palatine artery and the tonsillar artery. And the tonsillar artery from the facial artery, it is the main artery to the tonsil. The principal artery to the tonsil is coming from facial artery. Clear? Recent FMGE question, 2021 FMGE question. Right. Now, the facial artery also gives, see here, this is the facial artery. That is our facial artery. Now, the facial artery, which in turn gives this branch, that is our submental artery. Okay? Right. Now, the same facial artery entering the face, having the tortuous course, which gives this branch. I am going to mark this as number 1. This is number 2, this is number 3 and this is number 4. Now what is number 1? Number 1 is supplying the lower lip. So it is called inferior labial artery. Number 2 supplies the upper lip. So superior labial artery. Number 3 supplies the lateral part of the nose. Lateral nasal artery. And number 4 supplies the angle of the eye, angular artery. These are the 4 branches given by the facial artery in the face. Inferior labial, superior labial, lateral nasal and the angular artery. Now, we're going to see this branch. Now, this is the dorsal nasal branch. This dorsal nasal artery, it is a branch of anterior ethmoidal, and anterior ethmoidal is a branch of ophthalmic, and ophthalmic artery which in turn a branch of internal carotid. So this area, yes, that is the site of the anastomosis between external carotid artery and the internal carotid artery. Because the angular artery anastomosing with dorsal nasal artery, angular artery branch of facial, branch of external carotid, and dorsal nasal branch of ophthalmic, branch of internal carotid. Is that clear? Right. So now see the question. Which of the following is not a branch of facial artery? Lateral nasal artery, yes, branch of facial. Superior labial, inferior labial, yes. Now what is the answer? Mental artery. Mental artery is not the branch of our facial artery. Now this is our mental artery. See, mental artery is nothing but a continuation of inferior alveolar artery. Now the inferior alveolar artery is a branch of, very good, maxillary artery. Which part of maxillary artery? The first part of maxillary artery. The first part of maxillary artery will give 5 branch. Mnemonic, M-A-I-D-A. Maida is a mnemonic. M is middle meningeal artery. A, accessory middle meningeal artery. I, inferior alveolar artery. D, deep auricular artery. A, anterior tympanic artery. Okay. Now, this inferior alveolar artery, which in turn passes through mental foramen and continue as our mental artery. Now what are the branches from the third part of maxillary artery? The third part of maxillary artery gives 6 branch. Mnemonic, pig pass, very old mnemonic. What is P? Posterior superior alveolar artery. What is I? Infraorbital artery. What is G? Greater palatine artery. And what is P? Our pharyngeal artery. And what is E? What is A? Artery to pterygoid canal. And S, sphenopalatine artery. Okay, yes. Maxillary artery branches you have to know. NEET exam, you will get the question. So the answer for this question is mental artery. Mental artery is a branch of inferior alveolar artery, and inferior alveolar artery is a branch of, yes, first part of maxillary artery. Okay, yes. Now see the next question. Now next question, arrange the structures from medial to lateral in the cubital fossa. Again repeat question. 2019 exam, we got 2 questions from cubital fossa. They marked the median nerve and they asked the question about the median nerve. So again, they gave the question. Now this time they are asking you to arrange the structures in a sequence from medial to lateral in the cubital fossa. First, what boundary? What is the boundary for cubital fossa? Medial boundary, our pronator teres muscle. Lateral boundary, brachioradialis muscle. And above, the base is formed by the imaginary line connecting the 2 epicondyles of the humerus. Now what is the content? So content of the cubital fossa, MBBS is a mnemonic from medial to lateral. So mnemonic MBBS. Now what is number 1? Number 1, that is the median nerve. Now this is medial side and this is lateral side. Now why is medial side? Because we are seeing one small muscle here, that is pronator teres muscle, and number 4, that is the brachioradialis muscle. Okay, right. Now content, number 1 is median nerve. Now number 2 is our brachial artery. Okay, and number 5, that is our biceps tendon of biceps. Last, number 6, that is our radial nerve, the superficial branch of radial nerve. So mnemonic is MBBS, superficial branch of radial nerve. These are the contents of the cubital fossa. Okay, right. Now cadaveric image, they may ask you, they may mark any of these structures and they will ask you to identify the marked structure, the lesion to the marked structure. Likewise, they will frame the clinical questions. Okay, right. So the arrangement from medial to lateral is our MBBS is the mnemonic. So the medial most structure is our median nerve. So option A right, C right and D right. And then biceps tendon, no, brachial artery. And then biceps tendon and then radial nerve. So answer for this question is A is the answer. Okay, right. So now next question. Now nerve supply of the marked structure. So many times they gave this question, repeat question. NEET 2019, 2020 back to back they gave this question. Again they asked the same question. The nerve supply of the marked muscle. Now in the diagram the marking is on the lumbricals. Now why I am saying the lumbricals? Because the muscle is taking origin from this white structure. What is the white structure? That is our FDP tendon. FDP tendon origin. Now what about the insertion of lumbricals? So lumbricals are inserted to DDE. Lumbricals are inserted to DDE. What is DDE? Dorsal digital expansion. Okay. So now what is the action of lumbricals? That is a question they gave you in 2019 NEET exam. Now the action of lumbricals, this is the action. What is that? Flexion of metacarpophalangeal joint and the extension of interphalangeal joint. So the action of lumbricals, flexion of metacarpophalangeal joint and extension of interphalangeal joint. Okay, right. Now what is the nerve supply? Now nerve supply of the lateral lumbricals. Now this is 1, this is 2, this is 3 and this is 4. We have 4 lumbricals. Now the lateral 2 lumbricals, they are supplied by median nerve. And the medial 2 lumbricals, they are supplied by ulnar nerve. Okay, so all the muscles in the palm are supplied by our deep branch of ulnar nerve except loaf muscle, LOAF muscle. These muscles are supplied by our median nerve. So what is loaf? What is L? Lumbricals 1 and 2. What is O? Opponens pollicis muscle. What is A? Abductor pollicis brevis muscle. What is F? Flexor pollicis brevis muscle. Now these three muscles, they will form the Thinar eminence. Okay, right. So now see the question. Now in the question, the marking is on the first lumbrical. Why I am saying first lumbrical? This is the lateral side, this is medial side. So the first lumbrical is supplied by which nerve? First two lumbricals supplied by our median nerve. That is the answer for this question. A is the answer for this question. Okay, right. Now see the next question. The arrangement of structures in the hilum of lung from anterior to posterior. So now again it's an old question only, not a new question. Now in this diagram we are seeing the mediastinal surface of the right lung. Okay, mediastinal surface of the right lung. Now in the hilum of both right lung and left lung, from anterior to posterior, this is the hilum of lung. Yes. The arrangement of structures in the hilum of both right lung and left lung from anterior to posterior, it is same. The anteriormost structure is our pulmonary vein. So number 1 is our pulmonary vein. Okay, and next to pulmonary vein, number 2 is our pulmonary artery. And next we see the bronchus. Now fourth, now can you see one small artery here? Can you see the artery here? One small artery here. Yes, that is our bronchial artery. See, bronchial artery, they are situated posterior to the bronchus. So number 4 is our bronchial artery. Now from anterior to posterior, the structures are arranged like this only. The anteriormost structure is pulmonary vein, and then pulmonary artery, and then bronchus, and then bronchial artery. Okay, so from anterior to posterior, the same right lung and left lung, the same sequence is maintained. So the anteriormost structure is a pulmonary vein, followed by pulmonary artery, and then bronchus, and then bronchial artery. So answer for this question is option A, pulmonary vein, pulmonary artery, bronchus, and the bronchial artery. Okay, right. Now next question. Now post-operative patient of laparoscopic hernia surgery presents with altered sensation at the root of penis. The involved nerve is option A, iliohypogastric nerve, B, genitofemoral, C, lateral cutaneous nerve of thigh, and D, medial cutaneous nerve of thigh. Now for this, you have to know this diagram. Now in this diagram, we are seeing the iliohypogastric nerve. See, iliohypogastric nerve, ilioinguinal nerve, these two are branches from lumbar plexus, root value L1 fiber. Now iliohypogastric nerve supplies the lower part of abdomen, lower abdomen. Now ilioinguinal nerve is supplying the anterior part of the scrotum, and also the root of penis. Ilioinguinal nerve supplies anterior part of the scrotum and our root of penis. Okay. Now what about genitofemoral nerve? So genitofemoral nerve root value L1, L2. Genitofemoral nerve, it is a nerve involved in the cremastic reflex. 2017 November AIMS exam, they asked the question about the root value of cremastic reflex L1, L2. Okay, so genitofemoral nerve also supplies the anterior part of the scrotum, and also the root of penis. The genital branch of genitofemoral nerve supplies the anterior part of scrotum and our root of penis. Now the lateralmost aspect of the thigh is supplied by our lateral femoral cutaneous nerve. Now sometimes the lateral femoral cutaneous nerve may get irritated while passing below the inguinal ligament, which in turn result in one condition called as meralgia paresthetica. Yes, I think you know that. Meralgia paresthetica is due to involvement of lateral femoral cutaneous nerve. And the medial most aspect of the thigh is supplied by our obturator nerve, the femoral nerve, obturator nerve, they are the branches, and the lateral femoral cutaneous nerve. So all these are branches of lumbar plexus. Okay. Now what is the root value for our obturator nerve? The obturator nerve root value is ventral division of L2, L3, L4. Femoral nerve, the dorsal division of L2, L3, L4. Lateral femoral cutaneous nerve, dorsal division of L2, L3. Okay. Right. So now the question, yes, the patient is having the underwent laparoscopic hernial repair. Now, in the laparoscopic hernial repair, the most commonly affected nerve is the lateral cutaneous nerve of thigh and genitofemoral nerve. These are the two nerves affected in the laparoscopic hernial repair. Okay, right. Now, see the question. Now, these two nerves, chances are there to get affected. Now, the patient is having altered sensation at the root of penis. So, out of these two nerves, which nerve supply the root of penis? Our genitofemoral nerve. So, what is the answer for this question? Yes, genitofemoral nerve. That is the answer for this question. Not our lateral femoral cutaneous nerve. Because the patient is having loss of sensation of the root of penis. So, answer for this question is option B. Clear? Right. Now, next, the ligament connecting the medial cuneiform and the second metatarsal bone. Again, repeat question only. We discussed this question in the lower limb module. Yes, the same question only. Yes, we got in the exam. Now, we have some ligament, some eponyms, some named ligaments. Now, this is the medial cuneiform. Now, from the medial cuneiform to the second metatarsal bone, we have a ligament. What is the name of the ligament? Lisfranc ligament. So, Lisfranc ligament is extending from medial cuneiform to the second metatarsal bone. So, we got the answer. The ligament connecting the medial cuneiform to the second metatarsal bone is our Lisfranc ligament. Okay. Now, in the next exam, they may ask you about spring ligament or Chopard's ligament or deltoid ligament. So, what is Chopard's ligament, sir? Now, the Chopard ligament, it is a ligament involved in calcaneocuboid joint. Calcaneocuboid joint. Now, this ligament also called as bifurcate ligament. Now, this ligament is attaching to calcaneum bone, okay, and which in turn attaching to the stem is bifurcating, which in turn attached to this is navicular bone and this is the cuboid bone. So, calcaneocuboid joint, we have bifurcate ligament. That ligament is also called as Chopard's ligament. Chopard's ligament. So, Chopard's ligament attaching to calcaneum bone, the stem, and bifurcates, which in turn attached to the, yes, navicular bone and our cuboid bone. Okay, sir. Now, what about spring ligament? Now, this is spring ligament. What is the other name for spring ligament? The spring ligament is coming from the sustentaculum tali to the navicular bone. So, spring ligament is also called as plantar calcaneo-navicular ligament. Plantar calcaneo-navicular ligament. See, this question very often asked in JIPMER exam. Now, we don't have a JIPMER exam, only INACT exam, but in 2016, 17, 18, 19, 20, in those days, they were asking repeatedly about the name of this ligament, spring ligament. That is the question. So, what is the answer? That is also called as plantar calcaneo-navicular ligament, that is giving the support to the head of talus bone. And this ligament maintains the medial longitudinal arch. 3 points you have to know about the spring ligament. Number 1, the other name. Number 2, spring ligament gives support to the head of talus bone. And spring ligament maintains the medial longitudinal arch. And one more ligament is our deltoid ligament. See, deltoid ligament is also called as medial collateral ligament. Now, this is a main ligament for the ankle joint. So, this ligament starting from tibia, medial malleolus. From there, it goes to talus bone. Okay, and also goes to navicular bone and also to the calcaneum bone. Now, what are the parts of deltoid ligament? Now, the parts of deltoid ligament are number 1, number 2, number 3 and number 4. These are the 4 parts of deltoid ligament. Now, what is number 1? Number 1 is from the medial malleolus, from tibia to the talus bone. Anterior tibial. Number 2, from the middle malleolus to the posterior part of talus, posterior talotibial. Now what is number 3? Number 3 is from the medial malleolus to the navicular bone, that is our tibio-navicular. Okay. What is number 4? From the medial malleolus to the sustentaculum tali of the calcaneum bone, that is our tibiocalcaneal. These are the 4 parts of deltoid ligament. Chances are there to ask in the coming INA-CET exam and NEET exam, 2023 NEET exam. Very often we got this question. 2017, 18 and all, we got repeatedly about the question about deltoid ligament. Again they will ask you, don't worry. Okay. So now these are the 4 parts of deltoid ligament. See, deltoid ligament identification is very easy. Deltoid ligament also called as medial collateral ligament. No? So all the parts of deltoid ligament, they have a tag, tibia. Just to find for the word tibia. The word tibia is there, then that is a part of deltoid ligament. If the word fibula is there, then that is not a part of deltoid ligament. That is a part of lateral collateral ligament. Okay. Yes, that's all about this question. So the ligament connecting the medial cuneiform to the second metatarsal bone is our Lisfranc ligament. And we know about the other 3 ligaments. Right. Now last question. Our superior gluteal nerve supplies. Very easy question. Superior gluteal nerve supplies 3 muscles. What are those? Gluteus medius, gluteus minimus and tensor facial latae muscle. Piriformis, it is not supplied by superior gluteal nerve. Now see the diagram. Now in this diagram we are seeing the cadaveric image. We reflected the gluteus maximus and medius muscle, and this is our piriformis muscle, and above the piriformis muscle we are seeing the nerve, that is superior gluteal nerve and superior gluteal vessels supplying the gluteus medius and the minimus muscle. And see again, this is the gluteus maximus muscle, this is piriformis muscle, and number 4, that is our inferior gluteal nerve. Inferior gluteal nerve supplies only one muscle, that is our gluteus maximus muscle. Okay, right. So now the answer for this question is piriformis. It is not supplied by our superior gluteal nerve. Superior gluteal nerve supplies 3 muscles, gluteus medius, minimus and tensor facial lata. Piriformis is not supplied by our superior gluteal nerve. So these are the questions we got in the INA-CET exam, 2022 May INA-CET exam.